Hello again everybody, Jeremy Latham here, I'm the hip surgeon. Today I'm going to talk about complications. These are the things we dread most, both as patients and surgeons. I worked for a surgeon once who told me that any surgeon who says he never has complications is either a fool or a liar, and that's certainly true. When a patient has a complication, my job as a surgeon is to explain the problem to that patient and work out how we're going to get around it and try and make them better and reduce the risk of it happening again. Some complications, of course, can be life-threatening. I'll discuss those in the video. If you have any questions or comments, please do get in touch. If you like the channel, please subscribe. Thanks for watching. For nearly 60 years, hip replacement surgery has transformed the lives of millions of people. If you've got an arthritic hip, there is no treatment that is as effective as a hip replacement. It restores mobility and dramatically relieves pain. Surgery these days is usually very safe and effective. However, there's always the risk of complications happening. Surgeons love to classify things. Classification helps us to understand why something has happened and how we might treat it more effectively. When we look at surgical complications, we can categorize them into various groups such as immediate, that is around the time of surgery, early, up to 3 months after the operation, and late, which means any time after the operation. Here's a list of some of the complications that can happen after a hip replacement. Fortunately, the risk of serious complications like having a heart attack or a stroke are very low. We do a very thorough preoperative assessment and help you to address those risk factors which might increase the risk of having a complication. About 10% of people might expect to have some pain which persists after hip replacement surgery. And sometimes we have to operate again if something goes wrong. The risk of that happening is very low, less than 10% at 10 years. If you're unlucky enough to have a complication after surgery, it's really important that it's diagnosed and treated promptly and effectively. This might mean having further investigations such as a CT or MRI scan. Sometimes you might have to be transferred to another hospital which has access to diagnostic equipment and intensive care facilities. This happens very rarely. We'll look now at immediate complications of surgery. These are generally technical problems where the components have not been put in properly. This might lead to a fracture or an early dislocation of the hip joint. There may be a noticeable leg length difference or damage to nerves and blood vessels around the hip joint. Acute problems such as a heart attack or stroke can happen in the first few days after surgery. And sometimes people react to the drugs that they've been given. Sometimes a blood clot can happen after surgery. These clots usually start in one of the veins of the calf muscles. Occasionally the clot can break off and get into the lungs, and in a tiny proportion of people, this can be fatal. We take great precautions and care to reduce the risk of having a blood clot. You'll be given medication shortly after the operation, and this will continue for a few days after you're discharged from hospital. Once you've been discharged from hospital, things usually settle down pretty quickly. In a few cases, the wound doesn't heal up in good time, and we might need to bring you back into hospital to wash it out and re-close it. Leg swelling is common after hip surgery, but it usually gets better within 6 weeks of the operation. Medical problems such as nausea, vomiting and constipation can happen, but these are pretty unusual. Dislocation is something we worry about. The physiotherapist will tell you all about the precautions that are needed in the first few weeks after surgery to reduce the risk of dislocation. Some people get very frustrated because they think they're not as mobile as they should be. They compare themselves to other people who've had a hip replacement and they think they're not doing as well as they did. Don't despair. Everybody gets better at a different rate and most people achieve their goals within a few weeks of the operation. It's not uncommon to feel that the operated leg is longer than the other one. This usually settles down within a few weeks or months of the operation. Very occasionally you might need to use an insole in one of the shoes or even have a built-up shoe, but this is very unusual. For the vast majority of people who have a hip replacement, within a few months of surgery they've completely forgotten about it. There's a small risk of dislocation, perhaps 0.1 to 0.2%, and deep infection can occur at any time. The risk of this happening is far less than 1%. In the longer term, loosening and wear can cause the hip replacement to become painful. In some cases we have to take it out and start again. Some people develop reactions to the implant materials that we use. This has been a particular problem with some types of metal-on-metal hip replacements, but we no longer do these. Lots of people feel a bit fuzzy-headed after surgery, and this can last for a few weeks. It usually gets better. Some people do have more permanent symptoms. We have no way of knowing which people are more at risk of this than others at the moment, but research is certainly continuing to this complex area. From time to time we see some very unusual complications. In this case, the stem of the hip replacement, that's the bit that goes into the thigh bone, had suddenly broken. This was due to metal fatigue. We see this complication very rarely these days because the materials that we use are so much tougher than they were even a few years ago. Having heard about all the bad things that can happen, it's easy to forget that hip replacement surgery is still one of the best operations ever invented. The vast majority of people who have a hip replacement never look back, and it transforms their lives. Well, I hope that you found that was helpful. My job as a surgeon is to minimise the risk to you of having a serious complication. If you've had a complication after hip replacement surgery, speak to your surgeon about it. Work out with him what went wrong and what can be done to remedy the situation. If you'd like some more advice or a second opinion, please get in touch. Call my secretary Anne or send me an email. The details will follow at the end of the presentation. Thanks again for watching. I'm Jeremy Latham, I'm the hip surgeon.